And we're going to get started. I'm Dr. Rita McGuire, Chief Medical Officer here at Wakanna, and one of the co-founders of Wakanna as well. Tonight, like every Wednesday night, we do a topic. We try to do a topic. And of course, my buddy and business partner, Gerald West, said, Doc, why don't you do a topic on radiculopathy? So ridiculous, right? Radiculopathy. It's a really long word, but just to keep it real simple, it means pain, right? So what is radiculopathy? So what happens is that our spinal cord, or our spine, not the cord, but the spine is made up of all of these bones called vertebrae, right? So if you right now touch the back of your neck, the nape of your neck, you'll feel one of those bones, and that's a cervical vertebrae. And if you go all the way down your spine, you can feel these bones, right? And it's the area where the spinal cord travels, right? So in between all of these vertebrae, your spinal cord travels, and they also have nerves that come out of these spaces in the vertebrae. Now, everything's good until these nerve roots get damaged. They get either traumatized by maybe an accident, they may get damaged from a chronic illness like diabetes. They could get damaged because of just aging. They could get damaged from, working out all the time and an injury. But that is what a radiculopathy is. It's when the nerve roots either become pinched, they become damaged, and they result in symptoms called radiculopathy. So there's different symptoms depending on where the radiculopathy is. So it could be in the cervical area, like in the back of your neck. Take a moment, everybody, feel the back of your neck and feel that bony prominence. It's a vertebrae. If it happens there where a nerve root is compressed or damaged or pinched, you'll have neck pain. If it's damaged or pinched in the lower part of your back or the lumbar area, you'll have lower back pain. If it's in the thoracic area, the area that encompasses your thoracic area where your ribs are, your abdominal area is, it will cause pain in that area as well. And then as the nerve roots start to innervate different areas, it can cause things like a sciatica. Many of you, I've had sciatica when I was pregnant, right? And it's just the nerve roots being pinched or compressed because of the big uterus that's growing inside of women. So women have sciatica a lot in their pregnancy. So that is radiculopathy. Radiculopathy is just the compression that these vertebrae, these bones that happen to either pinch or damage a nerve that's in the spinal cord that gives pain. How do you prevent radiculopathy? Well, one way is by staying physically fit. And here at Wakanna, we love working out. In fact, we have a workout jam every Wednesday morning at 6 a.m. Maintaining a healthy weight. We've got products here to help you lose weight. All of these things will reduce your risk of radiculopathy. Also, the way you sit, the way you're positioned at your desk, the way you're studying, the way that you play sports, the way that you lift packages, the way that you may lift heavy objects. Even at the gym, you got to be really careful because one wrong move can cause trauma and can cause the pinching of nerves within those vertebrae as the spinal cord travels throughout the body. So here's a good example of lumbar radiculopathy, right? It occurs in the lumbar area and it can cause lower back pain. How many people have lower back pain? Put in the chat if you have lower back pain. If you don't have lower back pain, put in the chat if you know someone that has lower back pain, right? Because we want to take this information to those people and let them know that we have some help for them. It's also, lumbar radiculopathy is also referred to sciatica. And we just talked about sciatica, right? Most pregnant women have sciatica. It's the pinching of the sciatic nerve as it travels from the lower back area into the posterior buttock area and the back of the leg. So again, the lower back is the most affected area and symptom that you'll have in lumbar radiculopathy. Let's go to the cervical, right? The cervical is in the neck area. So cervical radiculopathy describes compression nerve roots in the neck or the cervical spine. Symptoms most likely occur in the neck, but they can also cause symptoms in the arm, in the hands, right? Because as the spinal cord is traveling throughout that vertebrae, it branches out into the arm area, right? Traveling all the way down to the hand. So you may have issues with your hands and with your arms and with your neck and not even know that it is caused by a nerve root that's being compressed from a cervical radiculopathy. And then there's thoracic radiculopathy. That is pain in the area of the thoracic area, where the spine can cause nerve compression, and it usually is symptoms of upper back. So if you have upper back pain, if you have neck pain, if you have arm pain or hand pain, sciatica pain, now you know more than most, right? That this could be caused by a radiculopathy. So the symptoms can result in pain, it can result in numbness, it can result in tingling. All of this is nerve damage. So again, it's all about inflammation, right? I teach this every single week, that the common denominator and culprit in all of these disease or pathological disease states that we face, many of us, is from inflammation. If we can reduce the inflammation, then we are really doing well. And we know that there are ways to reduce inflammation through what we're eating, and of course, CBD, as we'll talk about that later. So compressed nerve roots can come inflamed. It can result in severe unpleasant symptoms like sharp pain in the back, arms, legs, shoulders, weakness or loss of reflexes in the arms or the legs, numbness, tingling. It feels like pins and needles are shooting in your arms and legs. And then, depending on the location, again, of where this radiculopathy is occurring, will show up in the symptoms in that area. So cervical, thoracic, and lumbar areas. So again, the causes of radiculopathy is typically caused by changes in the tissues. So the tissue that the bone is now compressing becomes inflamed because the vertebrae is shifting or bulging, like we call bulging discs, or stenosis. When we get older, they start to fuse. All of these things cause compression of the spinal cord, compression of the nerve root as they're exiting those areas. So herniated discs, we talked about, right? That's a bulging of the disc. Many of you have had that, right? That can happen with a fall. That can happen with aging. That can happen from a sports accident. That can happen in the gym. So that's why it's really important to be very careful. Bone spurs. Oh my gosh. Dr. Rita had the worst bone spur ever. You guys remember a couple of months back, very, very painful. Well, that's an area of the bone being compressing an inflamed nerve root that can either come from trauma. My trauma was working out, doing too many burpees and doing too many high knees. It can come from osteoarthritis, which is an aging process, or any other degenerative conditions like arthritis. Some other causes that can cause some common radiculopathies, again, is narrowing or ossification of the spinal ligaments that can lead to narrowing of the space around the nerve root And what happens? That nerve root gets compressed, and then you have pain. There's also something called myelopathy. That is when truly the spinal cord is being compressed. So it's a little different from radiculopathy, which is more of the nerve root. But when you have a bulging disc, when you have issues like that, the actual spinal cord can be compressed. What's the difference? The pain is extreme. In myelopathy, the pain is severe. In fact, the only way that you can treat a myelopathy is a decompression surgery. They actually have to go in and operate. But we know that we do have products that can assist, at least with the symptoms that myelopathy can cause, which is severe pain. So just know the difference. Myelopathy is very severe. It can cause severe pain, poor coordination, trouble walking, and even paralysis. So again, knowing the difference, radiculopathy can overlap with things called neuropathy. A lot of diabetics get neuropathy. It is a peripheral damage to the nerve. Carpal tunnel syndrome is another example of a peripheral neuropathy. And we'll talk about why that's important, because we know that with CBD, and we'll look at the endocannabinoid system, there are receptors in the peripheral, central nervous system, brain, etc. So that's why it works so well. And then again, regular radiculopathy is pinching of the nerves that can cause pain. And many times you have to see a specialist. You know, you want to make sure that there is nothing severe going on, like a myelopathy, that needs surgery to decompress that pressure off the spinal cord. So consulting a spine specialist sometimes is needed. So how do you diagnose radiculopathy, right? You've heard me describe what it is, but many times doctors have to do extensive testing. We have to do a physical exam. We have to make sure the muscle strength and reflexes are normal. There's some imaging tests like chest x-rays, CT scans, MRIs, just to see exactly what the problem is. And then there's nerve conduction studies where we actually do testing on the nerves. It's called electromyography, where we can really pinpoint the problem, if it's neurological or is it muscular. So that is the way we diagnose. What's the treatment? Well, we know that when people have pain due to radiculopathy, they typically take Motrin or Aleve or ibuprofen. Those are called non-steroidal anti-inflammatory drugs. Well, we talk about how these drugs long-term can cause kidney failure. Even acetaminophen, Tylenol, long-term can cause liver failure. We've got other medications like muscle relaxants, Flexeril, or even opioids. And we know that opioids can lead to such dangerous things like addiction and overdose. And then there are other treatments like weight loss strategies, right? If you lose weight, that can help reduce the pressure on the problem area that is causing that nerve pinch or that nerve damage or that inflammation. Physical therapy is another treatment option for those that will help strengthen the muscles and prevent further damage. And then there's steroid injections, right? We love to talk about the fact that our friend just got a cortisol injection and they feel fine for a day or two. And then what happens? That pain is right back. Steroid injections have their place, but they also cause a lot of long-term conditions like bone loss. In diabetics, steroids increase your blood sugar, so it's not the best option for diabetics. And then again, with more advanced pain, with myelopathy and compression of the cord, decompression surgery is what is needed. But tonight we're going to learn about how cannabis, how this plant can help assist with those who have radiculopathy, those who have neck pain, those who have arm pain, those who have issues with lower back, with upper back, with thoracic pain in the thoracic area. And what is important to know is that the cannabis plant has two species. One species gets you high, that's marijuana, and then there's another species called hemp that doesn't get you high, but gives you all the health benefits of reducing inflammation, being a great analgesic, helping with pain, and helping to reduce those symptoms that we see in those who have radiculopathy. Well, the difference between hemp and marijuana is that hemp has a high level of CBD or cannabidiol and very trace amounts of THC or delta-9 tetrahydrocannabinol. Now, delta-9 is the most common compound in marijuana, and that's why it gets you high, right? It gives you the euphoria, the paranoia, the munchies, but it really doesn't do what we're looking for it to do, right? We want to get the health benefits and not be high. So we can enjoy our family, we can work, we can continue to do what we need to do in the gym or outside to lose weight, or just have a good quality of life, and that is through the hemp plant. Sourcing CBD through the hemp plant. So let's look at what CBD can do. You know, CBD can reduce inflammation. And we talked about how in radiculopathy, that spinal cord and those nerve roots that are coming out get inflamed. That's why they cause pain. CBD also is a great analgesic. So for me personally, I haven't taken ibuprofen, Aleve, Tylenol. I've not taken any of that since I was introduced to CBD in 2017. CBD also helps to reduce anxiety. You can imagine if you have a radiculopathy, if you have neck pain, shoulder pain, back pain, knee pain, sciatica pain, neuropathy pain, any pain causes anxiety. It causes anxiety to such a point where you can't sleep well, you've got insomnia, you have depression because you can't do what you used to do, you can't get out and enjoy life. It really alters the quality of your life. So CBD helps to reduce anxiety, helps to reduce depression. CBD also is a vasorelaxant, so it helps to improve blood flow as well. It also helps to reduce nausea and vomiting. You know, it helps to reduce seizures and convulsions. There's just a long list of medicinal benefits that CBD has, along with the other cannabinoids or compounds the cannabis plant makes. There's over 120 now compounds identified, but these right here are the main ones. These are the ones I want you to know about: CBG, CBC, delta-8 THC. We love our delta-8, right? Delta-9 THC, THCV. All of these cannabinoids are compounds synergized together and really, really help on a cellular level with those who have radiculopathies to help reduce inflammation, to help reduce pain. And so the way that it does that is through a science. There is something called an endocannabinoid system that we all possess. Every single human being has a human endocannabinoid system. And then every vertebrae has an endocannabinoid system. And this system is designed when you consume CBD, when you consume these products, it puts the body back in balance. And the way it puts the body back in balance is that there are receptors. There are receptors in our brain, in our central nervous system. There are receptors in the peripheral nervous system, in the immune system. There are receptors in every single organ and gland in our body that when you consume CBD, it puts the body back in balance. It reduces inflammation. It reduces pain. It reduces anxiety. It reduces depression. And it does it all through these pathways, these neurotransmitting pathways that modulate and regulate pain, that modulate and regulate anxiety, that modulate and regulate our sleep-wake cycle so we can sleep at night. And so this system is the most vital regulatory process in the human body. You know, every time I say that, I want to go back to Wayne State School of Medicine and ask for my money back, because they didn't teach me about the endocannabinoid system in medical school. Cook County didn't teach me about the endocannabinoid system in residency. And this is profoundly a very important system, just as important as the circulatory system and the way our heart beats, just as important as our nervous system or musculoskeletal system. This system regulates and modulates appetite, our metabolism, inflammation, pain, our cardiovascular function, our immune system, our energy, our memory, our cognitive function, our learning, our movement, our sleep-wake cycles. Every single system in our body is regulated by the endocannabinoid system, and they didn't even teach us that, but it's okay because we know it now, right? And so let's move on to our products here at Wakanna and how these products can help with and assist with symptoms of radiculopathy. What are the symptoms of radiculopathy? I want you to put it in the chat. Real simple: pain. Pain. It's either pain in the neck, pain in the arm, pain in the shoulder, pain in the butt, pain in the lower back, pain in the upper back, pain. So anytime that a vertebrae causes compression of the nerve roots, it's going to cause pain, right? And these are products that can assist with radiculopathy. So here at Wakanna, we have so many products you can choose from, right? You can choose from smokables, to tinctures, to topicals, to edibles, to essential oils, because essential oils are really important in reducing inflammation. We have products for everyone. But what's important is that we cannot make claims at all, right? The FDA does not approve of any of these statements. So we cannot say that CBD will cure your radiculopathy. But what we're allowed to say is that CBD will assist with symptoms that radiculopathy causes. And those symptoms are pain. So if you have pain, absolutely CBD can assist with pain due to radiculopathy. Radiculopathy is when the vertebrae in our spine causes compression or pinching or damage to those nerve roots as they exit those bony structures, right? And so let's look at our tinctures. Tinctures are products that you place underneath your tongue. And what I love about tinctures is that they work in about 15 to 20 minutes, but guess what? They stay in your bloodstream for about 6 to 8 hours. And so if you're on my calls, you know what I'm going to say, that we love to layer these products. Layering products means you just don't take a tincture, but you layer it and you add to other products that we offer here in CBD. Why is that important? Well, if you have significant pain, which most people do that have radiculopathy, you want to make sure that the CBD is constantly in your bloodstream until the inflammation is reduced. At that time, you can start to reduce the amount of products that you're taking, but absolutely you want to layer our products. That means you're taking not only the tincture, but you're taking our gummies, you're using the topicals, and you're using the smokables. Yes, you heard it right. You're using all of the products, even the spices, right? And so our tinctures are very, very special because our tinctures they have a proprietary formulation. Essential oils like peppermint, essential oils like turmeric, essential oils like black seed. Guess what they have in common? They're all anti-inflammatory essential oils. So they help reduce the inflammation in the body along with CBD, and the synergy is just very, very magical. So we have a tincture called our Hempranium 500. That is a great product to start out with if you have a radiculopathy. 3 drops in the morning under the tongue, 3 drops in the evening under the tongue is a great, great way. Now we have 2 different product lines. We have a Power, which is our full spectrum line that contains the legal limit of THC. That's the black labels that you see here. Or we have the Pure. Now our Pure products are the white label products. Those are our broad spectrum products. And those broad spectrum products are great products that work phenomenally well, but are for those who have random drug screens at their job, right? So we have something for those who may have random drug screens. Those are our Pure products. Again, 3 drops in the morning, 3 drops in the evening. Now, we do have a product called Hempranium MD. How many of you out there are on Hempranium MD? Put it in the chat. I want to see it. Now, Hempranium MD is our most potent tincture. So for those out there that have pretty severe radiculopathy, that means pain. That big word just means pain. Don't get nervous about it. The Hemp MD is something you may want to go for, right? It is, instead of 500 milligrams in a 15 ml bottle, it's 800, 900 milligrams of CBD in that 15 ml bottle. So it's really more potent for those who have more severe challenges. So those are our tinctures. And again, the benefits, our tinctures have a proprietary formula where we've enhanced with black seed, turmeric, peppermint. Our carrier oils are hemp seed oil and MCT oil. And what I love about our formulators, okay. What I love, I'm sorry, that was Dr. Akuji telling me about this patient that may deliver, but thank God he's here. I don't have to leave. What I love about our proprietary formula is that our essential oils that we've picked to put in these products address inflammation. They address what we're looking to target. Now, our topicals offer local relief. Local relief is really, really important when you have radiculopathy, right? So you've got your tinctures you're doing twice a day, in the morning and night, and the topicals you're going to use. I had to get my Dr. Rita's rub. Oh my gosh. I love Dr. Rita's rub because I can just take it and rub on the back of my neck or my shoulder or whatever is causing me discomfort and keep it moving. But at night, I like using the cream. I love using the cream at night to let that cream sit in on that sore knee, that sore shoulder, that sore lower back after working out so much. But during the day, I carry this with me at all times. It's just real easy and flexible and convenient to just rub something on and not have to wash your hands from the cream. But that's just my preference, right? So Dr. Rita's rub is not just because my name is Dr. Rita. I love it. It's a great product. The Power Relief Extreme Cream, again, using that as needed. Rub it in those areas to offer local relief for those inflamed nerve areas and muscle areas. We also have a 500 milligram. Now this one I like, it's almost like, because of the biofreeze sensation it kind of gives you. I really like that for after workout. At night, I use the Power Extreme Pain Cream, and during the day, I use the Dr. Rita's Rub. But everyone has their way and difference in what they love. Just use all 3 of them and figure out which one works best for you. Now, the topical benefits, again, they're offering local relief, reducing inflammation, biofreeze or any of those other products out there. You can use CBD to offer faster relief. And then our edibles. Well, you know what? This is like my newest favorite. I'm telling you, the Delta 8 is great. We have edibles that are gummies that are broad spectrum. That's our pure gummies for those who have random drug screens. We have our power gummies. That's our full spectrum gummies for those who like a little bit of that THC. And then we have our newest gummies, our Delta 8. Delta 8 is a cousin of Delta 9. So if you are out there and you are a fan of THC, or maybe you're out there and you have more of a challenging condition, you may want to get the Delta 8s if you're not sensitive to THC, because they're strong and they're powerful. You only need a quarter of a gummy when it's Delta 8. So we have Delta 8 in the 25 milligram, we have Delta 8 in the 50 milligram, we have our gummies either in 25 milligrams, our pure in our 60 milligrams. Again, we have something for everyone. We talked about radiculopathy, right? We talked about some of the treatment modalities, and one is weight loss, right? Getting some of that weight off of you can get the pressure off of those nerve roots. So we have a flat belly brew. That is a coffee. It is an amazing coffee that you can drink cold or hot. You can add a scoop of that coffee in your smoothie if you're not a coffee drinker, and it will help to reduce your weight by helping to reduce cravings for sugar, cravings for carbs, helping you to be more energized. We also have a bitter tea, and it is bitter, but I'm telling you, it's a great way to detox your body, to get that toxin and waste out so that you can really start living a healthy, active lifestyle, starting to work out. You don't have to do a boot camp. You can just walk. My new thing now is I'm a cyclist. You guys see my bike that I posted on the Bitters Challenge? Yes, I am preserving my knees and riding my bike these days. So there's all sorts of activities that you can do, but just know that our coffee does contain CBD. It is a broad spectrum CBD. So if you are on taking any random drug screens, you can drink our coffee. Our bitter doesn't contain CBD, so you're good for detoxing, but absolutely these gummies will help you sleep. These gummies will help reduce inflammation and reduce pain. So those are some of the benefits, many, many benefits in using edibles that contain CBD that address weight loss, detox, will also address inflammation and pain. And then our essential oils. You cannot leave these essential oils out. Essential oils are absolutely mandatory for radiculopathy symptoms, right? Peppermint, if you take peppermint and just use a little bit of peppermint on areas that is causing discomfort, peppermint reduces inflammation. Tea tree reduces inflammation. Eucalyptus reduces inflammation. Lemon reduces inflammation. So these essential oils are so important to have as well to improve and to reduce the inflammatory process that goes on with radiculopathy. And then our smokables. Oh my goodness. You can see I carry this as well with me at all times. My vape cartridge and my Dr. Rita's rub, I carry with me during the day. Why? Because smokables act very fast. They get into your system within 1 to 5 minutes. So if you're having issues with symptoms due to radiculopathy, which is pain, right? I can't say that enough, pain, anxiety, you can't get to sleep, you know, doing a smokable, hitting 1 to 3 pulls on your vape cartridge or your pre-roll or your premium flower, 1 to 5 minutes, you'll start seeing that relief. Oh, my neck feels so good. Ooh, that Dr. Rita's rub is just everything. Our vape cartridges come in our hypnotic. I love the hypnotic. That's what's on my battery here. I love it because it has the peppermint. I love peppermint taste. There's a raspberry jane, and then there's our Delta 8 cartridges. These Delta 8s are great. You talk about fast acting and more potent than the CBD ones. That's your Delta 8, just more potency, more bang for your buck. We have our CBD joint. That CBD joint, again, is great for those who have symptoms due to radiculopathy, which is pain. And then our premium flower, which you can roll or vape your own flower at your discretion. So again, the bioavailability when you smoke increases, it's more available to the cells, and it works faster. But that's not all. We have products that have CBD that you can use in the kitchen, right? So we have spices, our garlic fire, our flavor king, our chili lime. Oh my goodness, I love chili lime on my boiled eggs. There's something about chili lime and boiled eggs. Put it in the chat if you're like me. I love chili lime and boiled eggs. Our vegan butter. Our butter is, again, another way that you can use in your oatmeal. You can put in your coffee, your bullet coffee. You can put on your toast. You can put on your bagel. We have a Culinary Plus product where you can bake and cook with this tincture and still get the same benefits that CBD will give you in reducing pain, reducing inflammation, really addressing those who have radiculopathy. We have a hair care system, an SOS, save your strands. Now, you know, you don't really lose hair due to radiculopathy, but I would be remiss without talking and letting you know that we have hair care that contains CBD. We know that our scalp, our crown needs help as well. Our follicles, you know, hair loss, hair thinning, all of that happens as we age, and sometimes it happens when we do bad things to our hair, like traction. We have products that are for the home. They don't contain CBD, but we are still in the midst of a global pandemic. So we even have products that sanitize your countertops, your produce, your food, your hands. So we are super excited here at Wakanna that we have so many products to offer you. Now, sexual health really is important, right? It's important to have a healthy sexual appetite and sexual encounter with your partner. So we have products that contain CBD that address vaginal dryness, that address erectile dysfunction. We have a King of the Jungle gummies for those men who really have that desire to produce more good. That's a good word, right? So these are a lot of our products, our CBD lube, our G-Spot, our body butters, our aftershave balm, and then again, King of the Jungle sexual gummies. When we talk about CBD, start low and slow, right? Even if you have severe symptoms due to radiculopathy, I recommend that you start with Impranium MD, but you still start with 3 drops in the morning, 3 drops in the evening. At night, start with a half a gummy. During the day, you're using your topical, either your Dr. Rita's Rub or your Power Extreme Cream or the 500 milligrams. You're using your smokables, 1 to 3 pulls as needed, 3 times a day. So when we talk about CBD, starting low and slow and layering your products, using all of the products together is what really makes a difference. Because someone, honestly, that has moderate to severe radiculopathy and you give them a topical to rub on, they're going to get relief, but they're not going to get the relief that they really need. And that is using the tincture twice a day, using the topical as needed, using the smokable when they have those acute breakthrough pains, and using the gummy at night. Also using the spices, using the butter when they're in the kitchen. So all of these products are really recommended to use, starting low and starting slow. So there's so many great choices. You really can't go wrong with any of our products. I want to thank you for joining me tonight. I do have a testimony that I want to bring on the line. And let's see if I can find, are you out there, T-Mac? Unfortunately, my business partner, T-Mac, had a very serious accident And so I really wanted her to talk about how these products helped her with a radiculopathy that she got from her dog running into her and flipping her really in a bad condition. So T-Mac, where are you? I saw you and now you're gone. Let's see if I can find her again. Give me one moment. And if you have any questions, you can put them right there in the chat. Let's see. T-Mac, where are you? I think you're T-Mac on the, and I just saw her. Hopefully she didn't drop off because I called her name. You have some questions, you can put it in the chat. Let's see. I don't see any. Tammy McDowell says she's here. Okay, so can you unmute yourself if you are here? Let's see. I don't see you.
I'm here, sis. It's not letting me in.
Oh, what happened?
Can you hear me?
I can hear you. Try to get back in. Try to get.
Okay.
Try to get back in. So she was there and then she dropped off. Any questions at all? Someone said that they love their Dr. Rita's rub. They keep it in their purse and another bottle on my nightstand. I love it. Yeah, it's just so easy to just rub it on and go during the day. Thank you so much, Marilyn, for that. Vanessa, concerned about alcohol in the tincture. You want to rephrase your question? Alcohol in the tincture. Yes, so the CBD vapes on the website, Leaf Fry, are you a guest or a business partner? If you are a guest, you're gonna contact the person who invited you and they're gonna get those vapes to you. The vapes have to be picked up in our Chicago office. That's just the new rule on the vape cartridges. Can a female use KOJ? Yep. A female can use the King of the Jungle gummies to increase their sexual desire. Absolutely, yes. Absolutely, yes. Okay, so I see Tammy. Tammy, don't go anywhere. Okay, I just promoted you to a panelist so you can unmute yourself and give that testimony just like you told me it happened. Just a powerful, powerful testimony. You can unmute yourself, T-Mac, unmute yourself.
Dr. Rita, can you hear me?
Yeah, I can hear you now.
Okay, I'm terribly sorry, but I'm traveling. And as I'm traveling, every little area that we go into, my Zoom starts spinning. So I apologize. So now we pulled over so that I could talk to you guys. First of all, amazing testimony.
Can we see your beautiful face?
Let's see if I can do that.
There you go. There's that beautiful face. I can see you. There's that beautiful face. Yeah, don't move too fast. You're making us dizzy. Whoa. Okay, there you go.
Well, let me just start off by saying you did an amazing presentation as always. I'm on crutches right now, as you know, but I had a terrible accident in my field on the day after my birthday. My birthday was June 13th. I had an accident on June 14th, the morning of. Every morning I take my hemp MD. I start off with my hemp MD and my black seed oil. I didn't get a chance to do that because I went out early and took my dog out, and my dog was playing fetch with him and he got caught, got so excited. He ran. I turned my back away from him for a moment and he went up under my legs and flipped me over. My leg hyperextended, my kneecap went the other way. So I'm lying in the field, and when I tell you I was in excruciating pain, I couldn't move. I couldn't get the words out of my mouth. Finally, I was able to kind of adjust myself, and my son came out to help me. But what was so amazing was when he came out to help me, he said, "Mom, be still." I didn't realize he was putting my knee back in place. But when he did that, he said, "I need you to, right now, CBD is what you need. Don't do anything other than CBD. I want you to smoke this pre-roll." He's like, "Because you need to get this into your system really quick, and smoke is the quickest way to do it." So I'm just like, "Okay, thank you." And I'm just smoking on the pre-roll. He goes and gets my whole entire box, and he says, "Now do your tinctures." So I'm taking I do the pre-rolls, I do my tincture, I do my gummy. Within about 30 minutes, maybe 40 minutes, the swelling in my knees started to decrease. Now, what I'm trying to tell you is, I'm not making this up. There's absolutely no way you can make this up. My knee was as large as my head, darn near, and it was purple. I put the Dr. Rita's rub and the CBD Power Extreme on my knee, and instantly it felt like a freeze that came over it, and it stopped pulsating. My son then went and got me my morning coffee. Now, this is where it really gets good at. I drank my flat belly coffee. I'm sipping on. He's like, "Mom, come on, just sip on the coffee, sip on the coffee." Before I knew it, I was calm. I wasn't hyperventilating from the pain. I felt a whole different pulse over my body. I was able to then put the ice packs on and find some relief. That happened at 8:30 that morning, about 8:15, 8:30 that morning, 11:30 that night. My doctor, Dr. Mitchell, called me, and she wanted to look at my knee. We talked, and she told me I had done everything the right way. She wouldn't recommend me do anything else other than maybe take some leave if I needed an extra boost for the inflammation. So first of all, I want to tell anybody out there, if you're dealing with something that's onset and it hurt as bad as it did for me, if you have your CBD and you are a regular CBD user, please, please go straight to your tinctures, go straight to your vape, go straight to your gummies. Get that in your system because it works. And as Dr. Rita has been profoundly and prophetically telling us, layering works. I am a living, breathing testimony today, and I have not had any of those opioids, NSAIDs, none of that. It's been all CBD. So everybody pray for me that I don't have to have any surgery. But right now, I'm not in pain, and I'm enjoying some very good friends of mine that are here from out of town because of CBD. Thank you, Dr. Rita, for having me. I love you all. Thank you so much.
Thank you so much, T-Mac. Wow, what a great testimony that really shows us how we can use these CBD products and not have to use products that we do know can cause kidney, liver, and in-organ damage, right? Long-term use. Just think about it. Every time you have a headache or a pain, and you take Aleve or Motrin or ibuprofen, any of those non-steroidals long-term has been shown to cause kidney failure. Kidney failure. That's why we're seeing so many dialysis out there. Same thing holds true for acetaminophen or Tylenol. Just think about all the years you've had headaches or pains or aches, and you've taken Tylenol. Long-term use, it can cause liver failure. So we have products that are tested. All of our products are organic, sourced from organic fields. All of our products are tested with certificates of analysis that are safe and effective options for those who are looking for an organic, holistic way of addressing their pain or their radiculopathy, or like in Tammy's case, a very, very unfortunate accident that has caused a lot of pain. So that is our topic for tonight. The recording will be out. We really want you to share this information with those who weren't able to make it tonight. Maybe you have a guest that you know either has a cervical, lumbar, or thoracic radiculopathy. They're having pain in their neck, lower back, upper back, sciatica, neuropathy. These products absolutely will be such a great assistance for those people. And again, if there's any questions, please put it in the chat. We have a couple of minutes before I need to leave you. But there was a question about CBD and what's its effect on appetite. So CBD does a couple of things as it relates to weight loss. One thing it does is it turns that white fat into brown fat. Brown fat is the fat that's able to burn calories, increasing your metabolism. CBD also works on pathways in the brain that helps to curb cravings, that helps to reduce your appetite. And in our flat belly coffee, it is a great way to use it cold, hot, or there's some people who don't like drinking coffee, so they put it in their smoothie, or they'll put it in anything else that they could be drinking or eating to get that CBD into the system. So 1 to 2 cups of the CBD coffee, fat belly coffee brew a day is a great way not only to address weight management, but like T-Mac, reducing pain and inflammation at the same time. That's what's so wonderful about CBD. It does so many things at the same time. So if there's no other questions, I want to thank all of our business partners that show up every Wednesday. I want to thank our guests. If you're a guest on the line, what we want you to do now is contact the person that invited you. Let them know which products you want. Again, those vape cartridges, yes, you can get all the products. Some of them you have to pick up in the dispensary here in Chicago because of certain laws with the vape cartridges now, but just know that whoever invited you loves you, really cares about you, and really wants you to hear this information and get these products. We have a Father's Day special. What I love about the Father's Day special is that it has everything that you need in it for symptoms that can cause pain due to radiculopathy. It has the tinctures, it has the gummies, it has the smokables, it has the topical. So it has everything you need at a savings. So the Father's Day special is something you want to get. You want to layer all those products. All the products you need are in that Father's Day package. So connect with the person who invited you, and so you can get that Father's Day package and any other products ordered tonight. So have a good night, be well, be safe. Again, thank you so much for tuning in. We'll see you next Wednesday at 8 o'clock. You can always email me. Email me like all the other business partners. You may have a topic that's really burning that you want to hear about. Email me at Rita, RITAMD, @wakanna.com. I love to hear anything that you want to hear about. We'll make it happen. So be blessed, be well, be safe. See you soon.